Assalamu alaikum. My name is Hassan and the topic of my presentation is tuberculosis. Tuberculosis is an ancient disease caused by Mycobacterium tuberculosis. It is an aerobic, non-spore forming bacillus. It is different from other organisms in that it replicates slowly once every 24 hours instead of every 20 to 40 minutes. Transmission of tuberculosis. It can be transmitted by airborne droplet when a person infected by tuberculosis coughs, sneezes, speaks, or sings. Symptoms of tuberculosis are cough, fatigue, night sweat, weight loss, sputum may contain blood, fever, palsy. Tuberculosis may be multi-drug resistant. If the tuberculosis is multi-drug resistant, it may be primary drug resistance or acquired drug resistant. In multi-drug resistant tuberculosis, Mycobacterium tuberculosis is resistant to isoniazid and rifampicin. Primary drug resistant tuberculosis occur when a person gets a resistant strain before any drug has been administered, while acquired drug-resistant tuberculosis caused by addition of a single drug to a failing regimen, non-adherence to the prescribed regimen, inadequate dosage, malabsorption, etc. Here we have a case study related to tuberculosis. In this, a man 75 years old, his weight is 80 kilograms. He comes with complaints of difficulty in breathing, productive cough, loss of appetite, disorientation, congestive heart failure. His congestive heart failure was treated. Different tests has performed. PPD skin induration 16 mm. If PPD skin induration is more than 10 mm, then the person is susceptible to TB. Septum smear FB test, AFB test positive, acid fast bacilli test positive, blood urea nitrogen level is somehow normal blood urea nitrogen level is 10 milligram to 20 milligram per day, but he has 25 milligram per day. Scavenger receptor cysteine rich protein level 1.3 milligram. Chest radiography indicates that he has infiltration in his right lobe. Initial gram stain negative. We assess following for him: chest radiography, PPD skin test, sputum, septum examination for Mycobacterium tuberculosis, AFB. If the person has TB, then we recommended following drugs for him: isoniazid 300 milligram 2 to 3 times a week for 16 weeks. Rifampicin 600 milligram 2 to 3 times a week for 16 weeks. Pyrazinamide 20 to 25 milligram per kilogram Q24 hourly. Ethambutol 15 to 20 milligram per kilogram every 24 hourly for 8 weeks. We have to perform serum aminotransferase test for him. Isoniazid is hepatotoxic. CNS effective hypersensitivity are the adverse reactions of isoniazid. Rifampicin can cause thrombocytopenia, flu-like syndrome, renal failure, orange-red discoloration of body fluids. Pyrazinamide is also hepatotoxic. It can cause nausea, anorexia, rashes, dermatitis. Ethambutol can cause optic neuritis, skin rashes, drug fever, etc. When isoniazid and rifampicin are given, they both are hepatotoxic, but when they are given at a time, they can cause the severe hepatotoxicity, but their effects was additive, not synergetic, so they are not contraindicated. Caution should be used in high-risk groups such as the elderly, alcoholics, those receiving concomitant hepatotoxic agents, and those with pre-existing liver disease.